Welcome. Thank you guys for joining us for this community forum on hunger. For those of you who don't know, this event is being put on by the Auburn Area Democratic Club. My name is Bex Campbell, just a short way to say Rebecca, and I am the 2025 president of this club. We are hosting this forum in lieu of our club's monthly general membership meeting. If you want to know what's going on with AADC, I highly encourage you to check out our website. It's very robust. We have a lot of information on there. And you can also email the e-board, and our email is on the website. So if you have questions about what we're up to, how you can get involved, what's happening, please take a look at that. And now I'm going to pass the mic over to Dorian Seamster. Dorian is the chair of our Community Events Committee and the powerhouse behind this event. Dorian?
Good evening. I'm so glad to see so many of you here. So I just wanted to go over what our agenda is. So we've Bex did the welcome, and I'm going to go over with you what we're doing and why we're here tonight. And then we're going to have panelist presentations. Thanks, Sharon. You don't think it's on?
Oh, maybe I just speak loud enough.
You do. It is. Okay, is that better? Whoa, okay. All right, so then we're going to have our panelist presentations. We have 4 wonderful speakers this evening. Then we're going to have some time for Q&A, and then there's going to be, the last section is going to be about taking action. Okay, so you want to?
You have the clicker up there.
I got the clicker. Okay, so I'm actually going to wait for just a second. So I really wanted to just say something about why we're doing this evening. Like many of you, I've been reading Substacks and blogs and listening to different podcasts over the last few months because I've really wanted to try and figure out what I could do in our current circumstances. And it just feels like that we're in a time of crisis and that people in our community are being hurt and that potentially it's going to be even more hurt. And I heard a strategist, her name is Anat Shenker-Osarios, speak in a podcast, and she said that it's really important for us to be speaking up and to be protesting and writing letters and calling our representatives, but it's also a time to really turn and look at our communities and what's happening within our communities, because we can do something about that more effectively than we can really change policies at the federal level. And so that really inspired me to think about what could we focus on here in our community. And hunger and access to food was something that started really bubbling up. We're already seeing that there's federal cuts that are impacting how food is coming to the organizations that then distribute it, and also with the reconciliation bill that is both possibly really going to impact SNAP, which is the federal food subsidy program, and that it's really feeling like this is something that is already starting to hurt people and is the potential to do more harm in our community. So let's look at what we could do. So as we're listening to our 4 speakers, I want to encourage you to. Well, I seem to have lost. Okay, I want to encourage you to be thinking about why this topic is important to you and to our community, and also be thinking about what you wonder about and what you already know about hunger. So I'm going to give you just a minute. Everybody's got a couple cards on your chair, and hold on to your Post-its. We're going to use those for later, but you should have some cards and also a pen. And I'm hoping that you'll just write something down about what you're wondering about and what you're hoping to learn. And maybe just take a minute while we're bringing the speakers up. Maybe turn to somebody who's sitting near you and share what you're hoping to learn or what you're wondering about. Okay? All right. So we have 4 speakers this evening, and the 4 speakers are Ryan. You want to come up? And Ryan is the CalFresh program manager with Placer County Health and Human Services Department. And he's been in that, working for HHS since 2015. And during the Great Recession, he worked as a manager in the CDSS Fiscal Forecasting Bureau, developing estimates for human services programs for the state budget. So he's really informed about what's happening at the state level and about the CalFresh program. We also have Laurie, who I'm going to let you introduce yourself, but come up and have a seat. Yep. Laurie is from Feeding the Foothills. Dave Martinez was going to join us, but he had something come up that was very urgent. So Laurie's going to be speaking tonight instead. And then we're going to have Andy Hayes, and Andy is the president of Auburn Interfaith Food Council. He's a retired physician assistant, and he moved to Placer County in 2015 with his wife, Isabel. And he is president of this 100% volunteer organization, which is something I was interested to learn. And Tammi is the executive director and founder of the Gold Country Food Hub. And she's an entrepreneur whose career in technology, finance, and marketing involved into a commitment to regenerative farming and farm and land stewardship. And she's leading efforts to provide resources and infrastructure for a regenerative, equitable, and resilient regional food system. Okay. So I think the order's going to be Ryan, and then Laurie, and then Andy, and then Tammi. Okay. So Ryan, I'm going to hand the clicker over to you.
Thank you, Dorian. Good evening, everyone. Thanks so much for coming out. Oh boy, I already have a loud voice, so back that off a little bit. Except it wants to come loose now. Okay. Like Dorian said, my name is Ryan Fruchtenicht. I'm the program manager here over the CalFresh program in Placer County Health and Human Services. I've been working in social services programs since 2005. As Dorian mentioned, I have worked in quite a few different programs and in the state budget. I've been with the CalFresh program, though, since 2011. This program is very near and dear to my heart. It is the greatest anti-hunger program in the world. So what is CalFresh? So CalFresh is the California name for the Supplemental Nutrition Assistance Program, which was originally food stamps. So food stamps have been around a long time in America. The first food stamp program was around in the Great Depression in 1939, towards the end. And that was to get some of the recovering farm and agricultural production to individuals who were hungry in the cities, right? Simple program. You bought a stamp for $1. It was worth $1.50. That increased your ability to buy food. That's what CalFresh is. It's a supplement to people's income and for households that are between jobs or don't have income to be able to afford food. The modern program was piloted in the 60s. The first farm bill that included SNAP was in 1977, and that's the modern program we look at today. And that program had the coupons that folks were used to using in the store. Today we have EBT, that's the Electronic Benefit Transfer Card, and that's what folks use. The benefits for them get loaded on those. The program is reauthorized in theory every 5 years. That doesn't always happen. Sometimes there's, issues in Congress and things aren't moving as smoothly as we'd like them to move. And the bill gets delayed. And that's typically where all changes happen. However, sometimes they do happen outside of the Farm Bill. The Agricultural Committee does not necessarily like that because they really work with the states and farmers and agriculture and counties and people who run these types of programs. And so there's a lot more knowledge there. But sometimes the action is taken on this program and the bills. We'll be talking about what's happening at the federal level a little later. The funding, just to be aware of, is 50% state, 50% federal for the administration of the program, and 100% federal for the benefits that go to folks who are suffering from lack of nutrition. So who does the program help? So the program helps everyone. Almost everyone is eligible to the program. And we have a very diverse population that we serve in Placer County. We have a lot of households that have children in them. In fact, the majority of households have children. We have elderly and disabled households that we help. We have working people. We have homeless. So it's a really diverse group of people. Oftentimes people are just between jobs, they've just lost a job. And so they come to us for help affording food. We have had massive caseload growth. Since July of 2020 and the start of the pandemic, we have seen our caseload grow 86% in the last 5 years. My staffing is the same level. So we are doing everything we can, and we will continue to do everything we can to serve this community and make sure folks that don't have access to nutrition do. So we will be here come, well, I won't say that word, come HEW hospice and high water. Okay. And in addition to that program, we also have the Women, Infants, and Children program, WIC. Some of you may have heard of that. That helps young mothers and young families afford nutrition. CalFresh and WIC can be gotten together. So whenever you know someone who is a new mom or a young family that's struggling, we really want to encourage them to come to us and get both of those programs. And also, you can receive help from the organizations that are up here with me tonight. All of that is allowable. So we really encourage people to get all of those programs under them. We are aware, and studies show, that the more you meet these basic needs, the better they're going to be able to self-actualize and achieve in their lives, right? So those folks who are struggling, they're not really fitting into our society well. They're not getting jobs. They're struggling to keep jobs. This basic stability helps to further their cause to get to that level. So that's a really important aspect of this program as well, and the WIC program. We also have the Placer County Office of Education runs the school meals program, the breakfast program, and the California Department of Social Services also runs a fairly new program called Sunbucks. That is a summer meals program that actually helps families with school-age children over the summer months. A couple other things I wanted to mention. If you have a chance to head back to our table in the back, Mary Barker, our outreach supervisor, is there. And we have information on all of our programs and other information on these couple of programs I'm about to mention. One of them is our Placer Food Coalition. A lot of the folks up here with me attend those meetings. We need more people. We need more people focusing on this issue. And that's why this meeting is so important tonight. And I'm so thankful that it's happening. We want folks from the community there as well, and really recognizing what's going on and what they may be able to bring to the table. If you have time, if you have resources, there is always need in this county to help those who are suffering from a lack of nutrition. So please check that information out. We also have a new program we're trying to get off the ground called Eat Well. It connects food producers with families that need food. So what would happen otherwise, and what we don't want to see, is that food would end up going to a landfill. We would rather see that food wind up in someone's belly. So please, Mary's got information on that. If you're a vendor, if you're a food producer, we're looking for more folks to sign up. If you have time to volunteer, if you know people that need help, please take that information and get that. This program is also one of the best and most direct infusions of tax dollars back into local economies. Research you're seeing up there, every dollar of CalFresh produces $1.54 in economic activity. So what that means is that federal dollar comes into our state, comes into our local economy, and it produces economic activity. And that's in the form of all of the jobs that are supported by food production, manufacturing, distribution, sale. It really hits hard. This matters at the federal level as well. This increases our GDP by that much. So it's a really important aspect of this program. We are issuing about $5.2 million in benefits a month right now, and that is about $8 million in economic activity for our county. So this program really doesn't just help people eat food, it truly helps drive our local economy as well. So what's happening and where are my concerns as a bureaucrat? So right now, the good news is, even though there's a $12 billion shortfall in California, the administration of CalFresh has $88 million more allocated to it in the May revision of the governor's budget. For those that aren't familiar with the budget process, the budget comes out in January. There's a lot of discussions, a lot of committee meetings. Then the budget is reassessed in May and a May revision is released. And there's some more haggling that goes on. And then by June 15th, a budget needs to be at the governor's desk to be signed. So we're thankful for that. That really is the money that allows us to serve the community. And so we're thankful for that. However, the out-year projections are not good. And so just be aware of that. I know we're all concerned about that, but that is where things are. And we don't know what's going to happen economically. I hope for the best, plan for the worst, right? So we're looking at potential cuts in the future, but right now, this year at California's program, we're in good shape. At the federal level, the reconciliation bill that just came out of the House is the only thing I can speak to. We don't know what's going to happen with the Senate yet and what that version of the bill will look like. Then they'll have to conference and make amendments and decide what they're going to do. So the Senate will determine what they want to add, keep, modify, or delete. And obviously, we're tracking that. I have to track these things as part of my job, so I'm well aware of them. So this first, they're talking about cutting $300 billion from SNAP. That's the goal that has been put out there for this reconciliation bill. So this first bullet about reducing federal contribution to states, this has most states very concerned. This has governors very concerned. This honestly has folks in the Senate concerned as they're looking at the House bill that came to them. For a little bit of background, currently cases are sampled. And there's a quality control payment error rate. And that rate is sort of like an audit of our program that we do on a monthly basis. And FNS gets that information. They re-review a lot of the cases California looks at, and then they develop a rate for us. And what that rate is the percentage of benefits that were incorrectly allocated to families, either under or over issue rating. And right now, nationally, that is at 10%. Why is it at 10%? That seems like a lot, right? Well, it's at 10% because while we experienced this caseload growth, so did every state in the union. And they had the same staffing levels. And unlike private industry, government is here to do the things that private industry can't or shouldn't profit from, right? We can't just scale staffing to the level we need to scale it to. So we have the staffing we have. We can do budget requests to get more staffing, but it's always challenging and it's always dependent on available funding. So these rates do go up as things get harder and caseloads grow. They generally track back down, just like benefit levels track back down as the economic recovery goes. I've been used to seeing that for 20 years. I'm not seeing that now. We have maintained this caseload even though unemployment rates are down and more people are back to work. The inflation is what we really see as being the key driver to that. So what is the bill doing? The bill is saying that we're not doing a national average anymore. There are going to be benchmarks for this error rate. And regardless, if you have a 6% or less error rate, states are now going to pay 5% of benefits. Again, this is the House version. Whether this makes it to law or not, we won't know until the president signs the bill. That equates in California to $615 million budget shortfall. So we'd have to come up with that. What does that look like? Well, there's a lot of mechanisms at the state level and at the local level that people look at where cuts can be made. It might not be solely to SNAP. It might be in other areas in the state to make up that general fund shortfall. We're at 10% right now. At 10%, that would be 25% of benefits. That would be a $3 billion shortfall. We have a $12 billion shortfall that is resulting in a lot of cuts right now. So I think you can imagine this is not great news. But there are, like I said, ways that states can figure out how to backfill these things, but this will affect all 50 states in the union. By taking away that average, like I said, it also takes away sort of these ebbs and flows of what's happening economically in society. So the error rate will just be what it is, and we'll be paying those rates. That's hard to predict what impact that will have. Like I said, states will have to figure out how they're going to mitigate that shortfall. So we don't know what that looks like as far as caseload goes. The Congressional Budget Office is not really defined what that kind of cut could look like. The next item is a change to rules for immigrants. So right now, federally, no immigrant is eligible in the first 5 years they're in the country. California and many states have a general fund program that they will run. Ours is the California Food Assistance Program. It helps these individuals who have qualifying immigration statuses. It's a fairly limited number of statuses that qualify anyways, like student visas don't, things like that. But you don't necessarily have to be a legal permanent resident. The change in the bill is that you now have to be a legal permanent resident. So the Congressional Budget's Office is estimating that between 120,000 to 250,000 refugees, asylees, victims of human trafficking, and domestic violence victims that have come to our country will be cut from the program nationally. I can't give you numbers of what that is in Placer. We haven't done the research yet because we don't know what the bill is going to be. As soon as we know the bill, then we'll be looking at those things, working with our local community to figure out what that's going to look like, working with the state to figure out how that could be implemented and how to get that word out. The other item that I wanted to mention, there's other things happening in this bill to SNAP, but the other one I wanted to mention, just to try and save time here, is they're changing the work requirements. And this is a pretty big change. They're raising, there's a provision in the law called the able-bodied adults without dependents, right? That without is key, right? And that says that anyone between 18 and 54 must be working at least 20 hours a week or have an exemption from the work rule. They're expanding that to 64 years old. So that's going to change what that looks like and how we administer that program, and it will result in additional people losing benefits. There's also a really big change. That without adults piece is kind of being thrown to the side. And the change in the law would be that anyone with children 7 and older, those parents would be subject to that work rule as well. So the CBO is predicting that about 3.2 million people across the country will lose benefits because of that. And about 800,000 parents would be removed from the household. The children would still be eligible for benefits, but the parents would be removed from the household, reducing their benefits. So again, we don't know what the final laws are going to be. We don't know what the changes will be. Regardless, we're going to be here in Health and Human Services to help the community. And I don't want a chilling effect from these things that people don't get sent to us. If you know people in your community and you know people who need help to afford food, please have them come to us. We've got information at the back table that they can find ways to apply. Let us be the arbiters of whether people are eligible or not what we hear in the news, not what we see there. It really needs to come from us, and we really want to encourage everybody to come to us that needs help. Regardless of how big the caseload gets and how small my staff is, we are going to be here every day doing it. So please make sure you get the word out there, track these things. And I want to also put a plug in for these wonderful organizations up here with me. We need volunteers, we need resources, we need help. As this goes along and as we continue to see this challenge with folks finding nutrition, we really want this call to action that everybody who's got the time and has the resources, or if you are hungry or know people who are, send them to us so that we can be that help in this community. So thank you, everybody. I'm going to turn it over to Laurie.
Thank you, Ryan. Sobering facts. My name is Laurie Rinker, and I'm a Regional Philanthropy Manager with Feeding the Foothills. What does that mean, Regional Philanthropy Manager? Well, my job is to get the word out and to fundraise. I work with 4 other people in my department. It's called development. We do a lot of analysis with Salesforce, et cetera, but basically, we're about getting the word out and giving people the opportunity to be engaged with us through volunteerism and through philanthropy and dollars. So let's just talk a little bit about who Feeding the Foothills is. Who's heard of Feeding the Foothills? Oh, good. Of course, you knew we used to be called Placer Food Bank, but we're part of Feeding America. And Feeding America is a national food bank organization, and we are one of 200 food banks. We're a medium to small size food bank. And we've been assigned Nevada County, Placer County, as well as El Dorado County. So we are the region's premier or primary hunger hub. We distribute fresh and non-perishable food to over 90,000 individuals in these 3 counties. Through a partnership, a network of 70-plus partners, such as Auburn Interfaith, we so appreciate them, and many of our other partners, sort of matrix. We have a 77,000 square foot warehouse up in Roseville, right off Washington. And what happens is all the food trucks come in the front door. We get food from our partners, from our farmers. We get food from stores. They come in. We get them all organized. We have a whole area just for emergency services. And our partners come pick up the food out back and deliver them out to all of the hungry folks. We also have a number of different formal programs that we run. One is Pantry to Go. Does anybody know where Denio's is? You ever get down to Denio's? That is a massive pantry to go for us. So what happens, we have 1,700 active employees. We have 5,700 on the books, but active this year. They come into the warehouse and they pack up fruits and vegetables and get all the food ready for distribution. We then send our trucks out to like Denio's, and we stand out there with tables and we put food, vegetables, fruits, baked goods, in people's cars, and off they go. And I will say, being out there, you go like, what's this guy doing pulling up in a Mercedes? You cannot judge. You don't know where that car came from. And people are so, so very grateful. We also have senior distribution programs. We have school programs. And as I mentioned, we are a disaster first responder. And we get food out with those fires. Whatever happens, we are right there. So, we talked a lot about what's happening politically, and it's sad. We've had to lay off 20% of our staff. And I don't know that we're done yet. So, what's happening? We have the expiration of emergency COVID-19 funding. So we've already felt that over the last couple of years. Funding is down, donations are down. There has been a sharp reduction in available government and relief dollars, which we had before. There's a decrease in CalFresh, SNAP benefits, and end of emergency allotment. There's inflation and rising cost of living. Employed individuals and seniors with fixed incomes are increasingly food insecure. And seniors is really a big problem, as you've highlighted. There's a shift in federal and state priorities under this new administration. Fewer funding opportunities for hunger relief programs, grants, which is a huge piece of our budget. Added administration burdens make it harder for nonprofits to access and receive approved grants. There's an increased need without matching resources. So what's happening is the demand is outpacing the capacity. We cannot keep up. Last year, we said, okay, we're looking at an increase of 10% or more. Well, I don't know what that's going to look like. Any predictions, Ryan? 15, 20%? We do not know, but we can't keep up. Right now, we distribute over 11.6 million pounds of food to 1.1 million individuals. This has a staff of 40. Well, we just had to lay a couple off this past week. So we're in a little bit of a sticky wicket here. So what does that mean for us? Let's look at what those numbers mean. There's a 200,000 reduction in grant funding in the past year. And we can't grow our programs. We had this fabulous program called Insight Services we were going to employ, where we would find out more who people are coming from and what zip codes, well, we had to lay that person off. So it's very hard for us to improve and increase our programs. Cal Food funding dropped from $400,000 to $76,000. Slashing our capacity to purchase healthy staple foods for distribution across our 3 counties. Donors. The economy's tougher. People are uncomfortable about giving. We've seen a reduction of 8%. But people are still giving. They're just giving a little bit less. Retail recovery of in-kind donations, such as Raley's or Safeway, grocery stores, they're going to get worse because people are going to be hungry. They're not going to be able to spend money, so they have less money to give to us, and they have less food to donate to us. USDA Commodity Credit Corporation distributions have plummeted from 185 loads to just 35. That's a net loss of 150 loads of food, a major blow to our emergency food assistance program. So we're going to do the best we can, but we're in trouble. The elimination of the LFPA, Local Food Purchase Assistance Program, working with our farmers. It's been a great program. That's been slashed. Potential SNAP, CalFresh benefits cuts are looming. It's scary. So Dave Martinez, our executive director, who I wish was here with us, is an incredible visionary worker. He has been with the food bank for 40 years. He was one of the second employees. Every day with Dave's vision and drive, he keeps us alive. He keeps us going. He's an amazing man. And so I hope you have a chance to meet him. In fact, if you ever like to come down to the warehouse and take a tour, my cards are in the back. I'd love you to come down and see what our operation looks like. But let's go to our neighbors. Okay, we've talked the numbers, all these horrible things, but what is the impact on the neighbor down the street? The person you don't know is having problems because we do not know what happens behind those closed doors or in that spanky new car or the Rolex watch. So what's going to happen is more people are going to go without basic nutrition. Food banks, pantries, meal programs run a food faster. Families skip meals, buy cheaper food. Let's just have some mac and cheese. The kids will be happy, and I can't eat all of it either. Less nutritious options. Children face stunted development. Kids are a big thing for me. It's about the kids. If they don't have good food, their brains don't develop, and it's going to hurt us all in the long run. They'll have behavioral issues and poor academic performance. Health outcomes worsen. And I don't mean to be all gloom and doom. There's some positive things, and the positive things are us. But these are the facts. Hospitals and clinics see more emergency visits for preventable issues that if they just were eating correctly, it wouldn't be a problem. Emergency visits go up 22%, and we all know how that impacts healthcare and what we pay on insurance. The rise in diet-related diseases, diabetes, hypertension, obesity, and again, seniors and medically vulnerable populations will suffer the most. So hungry workers are going to be less productive, children will underperform, healthcare and social safety costs increase, and then there's the erosion of trust in our government. This government's not taking care of me. They don't care about us. What's going on here? Because nonprofits struggle to maintain donor confidence, a widening gap between the need and support, the whole thing creates system instability. So, and I'm not clicking. I realize I haven't clicked. Is somebody clicking?
It's this button.
Thank you very much, Neva.
Button there if you need it.
All right. Again, there are a lot of negative things going on, but how I feel and how I see things, they just had me increase the amount of funding that I have to get from individuals 20% yesterday. I said, oh, okay, no problem. So we have to be creative. We have to be creative with the people that have hearts that care about their neighbors. We have to be creative about our approach. We can't just be asking you for money. We need to get involved. We need to see what's going on. We need to get social media out there. We need to speak. We need to talk. We need to share. So I ask that you could either give financially or give of your time if you want to come down to the food bank and get trained to see how to pack those vegetables up, or if you want to help me fundraise or give me ideas or talk about my strategies or talk about how we can do things better. We are completely open to any advice at this point because we need help. The other thing, rally your neighbors. Say, oh my gosh, I just went to this meeting. I heard all these facts about food. We got to do something. Let's help the food bank. Let's do whatever we can. Or you can call your elected officials. Now, we know it's a tough road to go, but it takes a village. So all of these things together and any ideas that you may have, again, we're certainly open. We so appreciate your support in the past and certainly appreciate anything you can do to keep the food bank, Feeding the Foothills Food Bank, open so we can do our job and feed the hungry. I thank you. Oh, I did want to say, I have three handouts on the back. One talks about who we are and how we distribute. The other one talks about all the different ways you can give. And the other is a fabulous article that was just written in the SAC Business Journal about food banks, Brace for Crisis. And if they're all, if all my copies are been taken, give me your email and I'll go ahead and send it to you. All right, thank you again.
Thank you very much for coming out, and thank you for the invitation from the club. I'm a data geek, so you're going to see some graphs. And we're going to walk through some of the history of what we've seen in this county, in this community where we serve over the last 25 years. Because I think you can look back and see what's happened to possibly use that to try and inform what may go on next. And so the title is Past, Present, and What's the Future? Just who we are. The Auburn Interfaith Food Closet covers 17 zip codes in central Placer County, from Loomis up to Immigrant Gap, centered in Auburn. And the 75% of the people who come to us live in an Auburn zip code. People who come to us do not need to do anything more than walk across the threshold and say, I need help. There is no threshold of income. That just walking across the threshold for a lot of people is the toughest thing. And they will receive 4 days worth of groceries for every member of the house. So a family of one's going to get much less than a family of 5. Our average family is about 3. And if they were to take the food, go out to the grocery store and buy the food we give them, it would cost them $150. They can come once every 30 days. And so you can imagine that $150 that they don't spend on the food we give them is available in their budgets to do other things. And so this is one of our promotions. And you'll see one of our flyers that we hand out is your budget tight? And it's on one side English and the other side Spanish. We're also 100% volunteer. And so you can imagine the last slide when what can you do for us? I'll have a conversation on that too. So the first graph, you'll see different things. We measured 3 things, but they essentially are the same. One is we measure the number of meals we serve. The second is the number of families that walk in the door, and the third is the number of individuals. But they really are pretty much scale. What I have done on this graph, this shows the 25-year history from 1999 to 2024. I have color-coded in the administrations that occurred. And there are 3 yellow stars on that graph. And those are what I call trigger points that affected things. Now, if you were there, as you know, you can lie with statistics. And so the first thing I would take away from this slide, first looking at it, is if it's a Democratic administration, in the first 4 years, things get really bad. The number of people goes up. That's what this shows. Well, the trigger point before Obama became president was the banking and housing crisis that occurred because of the in the 2007 and the end of the Bush administration, and it took a while for that to recover. Auburn had 11% unemployment at the peak, but it was a delayed response. You can see that even though that occurred then, it was 4 years before we hit our peak. And that delayed response was multifactorial, but part of it was many of the people who ended up coming to us didn't come initially because they were too proud, and they spent down their savings, and they increased their credit until they had nothing else they could do, and they finally had to come. From the peak in there, you can see there was a steady decline in the number of people coming to us. And it kind of plateaued at the end of the Obama administration. And we sort of artificially created that because we then went out and saw we weren't touching as many people that were food insecure. And so we put promotional activities together, get into the community, make sure we were known and seen. There's 2 trigger points then in the Trump administration. The first one is COVID. I know you saw news articles and reels and videos that showed lines of cars pulled up and waiting. We didn't have that happen in Auburn. The number of people who came to us needing food dropped in half from the day COVID started for the next 18 months. We believe that's because of all the government programs, and the spendable income that many of the families had went up. They had more SNAP benefits. The child tax credit was there. There was more money. They also couldn't eat out as much, and so they were actually eating smarter, and they were and less expensive. The second trigger in there is actually, if you go look up when did the inflation start, it started in 2020, at the end of in January or in December. So 2 triggers that have impact. And you can see from, as Laurie mentioned, this huge increase from the July of 2021. We had 30 consecutive months of increased people month over month, compounded. So you can see that graph went from somewhere around 1,200 families one year all the way up to over 3,000. So we had 2.5 times the number of people coming and demanding our services to the end of 2024. This is what we did in 2024. A little bit of detail, but I want to focus on a few things. But each line in here represents one of 3 programs in which we're providing food. The on-site program, someone drives up to our offices, they walk in the door, they get 4 days worth of food. 85% of the people we serve is in that program. The second program is a home delivery program where we go out and take vans out to people's homes and register them. We have a little over 200 families that participate that. They get involved once a month. They get the same food as they normally would. They get contacted and they actually get to pick the foods they want. Because we're contacting them, they actually participate more each year than the people that drive up to us. The third program are the homeless. These are people who do not have refrigeration, do not have cooking facilities. So what we do is we provide them 1 day worth of food. First thing I want you to look at is that box up in the upper right-hand corner. Of the people who come to us 4 times on their own, they only come about 4 times a year. They could come every 30 days. What that says is they are making do and making it month to month, most of the months out of the year, and they're not going to come and take the $150 benefit for savings. That's just not in the culture of people who live at the edge. Second thing I want you to look at is if you look at the bottom in the 2 red boxes, we had served 7,500 unique individuals during the year. 2,300 of them came to us for the first time last year. 1 out of 3. Yet we only grew 17%. So that suggests that there's also a population churn in our community. And we really discover that when you look at the 1 day, where you can see of the 1 day people, two-thirds of them are new each year. So these are people who are coming into the community, maybe seeing us once or twice and then disappearing. If you look at our 17 zip codes, there's about 90,000 people. This is in the box there, the first middle box. There's about 90,000 people that live there. Current estimates are somewhere between 12 and 13% of people are food insecure at some point during the year. Look around this room. 70 people in this room? 1 out of 6, 1 out of 7, 1 out of 8. Yeah, so 10 of you are food insecure. If it was a normal population. We don't see it. We don't feel it. Yet it's there. Last year, between all of our programs, we touched 72% of that population. Once, at least. And through a couple of other programs, we take food up to a couple of communities in Colfax, Forest Hill, and also in North Auburn, we probably touched another 8%. So we're probably pretty well penetrated into the people who need help at the moment. So I want to show you a little bit about how we survive. Upper right is, we've got a $500,000 budget. And we spend about 75% of that on food that we actually purchase. But we give out more food than that. And so the bottom left shows that of that, we give out about $700,000 worth of food. Some of that comes in from feeding the Foothills. Some of that comes in through food drives that we run or the community does, or food we glean from stores that they provide to us. Our income, the upper right-hand corner, is probably going to be more than what we're going to spend this year. And it consistently has been. We have most of our money is through individual donations. We have one federal grant for $25,000 that supports the home delivery program. And we've gotten paid that for this year. It's Project Go. It's a block grant, and it's through Project Go. We don't know that we'll have that next year, but we've had it now for 6 consecutive years. And it goes to help that home delivery program. The county created a grant earlier this year, in which we have another $25,000. That was actually for human trafficking. And went to Stand Up Plaster, but we are getting some portion of that to provide food services to people who might be affected in that area. Other than that, we are not in the same situation that the Feeding the Foothills is. We have not been overly dependent on grants. So that does mean we have a lot more, I think, headroom to be able to do things. Now, that said, we have risks. If people utilize us more, that group of people who only came 4 times last year, if every one of them came one more time, that'd be another $150,000 in food we'd have to buy. If inflation goes up, that's going to hit people. Not necessarily because the food's more expensive, but if the gas, the housing, the medical expenses. If their income goes down, what happens if veteran payments go down? What happens if Social Security is touched? What happens if Medicare is cut and people now have to spend more out of pocket to take care of those things? That's also going to affect what they can do. Those are the risks that we have, the headwinds we may have ahead of us. But if you look at this graph, we haven't felt it yet. We haven't felt anything this year. So if you look on the right, you can see that happens to be meals. And what I also showed there is to put the point of what Laurie and Dave were pointing out. The second line there was the amount of money value we got from Feeding the Foothills. You can see that started to drop off late last year, and that was a part of COVID programs being cut and food flowing through them. It's down even more so far this year. We make up for that out of our purchases. But on the right-hand side, you can see 4 years together. The bottom one is That's the number of people that came each month in 2022, the second one 23, the third one 24, and at the top left, the 2025. We continue to grow through the middle of 2024, but since the middle of 2024, we've pretty much been flat. And the numbers that we've seen in the first 4 months of this year are not that different than what we expected to see and budgeted for. That will change, maybe, but we haven't seen it yet. So, what can you do for us? You got 2 hours a month? I got a job for you. Got 5 hours a month for us? I got a job for you. You got 10 hours a month? We got a job for you. You got 10 hours a month, but you don't know you can give it to us every month? We got a job for you. Talk to us later. Thanks.
Hi, everyone. I'm Tammi Riedl, and I am here with the Gold Country Food Hub. I'm the founder and executive director, and I noticed that a few of our board members are here tonight. So I just wanted to say thank you all for coming. I think it's just really amazing that we can all be here, to really be thinking about how we can take action on hunger. Hearing from the other, panelists today, like all the statistics and everything, it's pretty overwhelming. And I have enough that's overwhelming right now just with my own statistics. So yeah, it's really great that we can really come together and think about how we can all make a difference. So I'm going to share, how do I get it up there? There we go. All right, there we go. So I'm going to share a little bit about the Gold Country Food Hub, the impact of the recent changes in some of the funding for our California farmers, how this is affecting getting fresh local produce to our food insecure communities, and what we can all do to advocate and support. So the Gold Country Food Hub is a nonprofit organization that was founded in July of 2021. How many people here know what a food hub is? Okay, so not many. So I'm going to tell you just a little bit. We are basically the middleman between sourcing food from our local farmers, farm fresh produce, meat, dairy, eggs, and getting it to different entities like the food bank, the community food distribution partners, schools, farm-to-school programs. Some of you may have heard about that. So that's really become big in the last few years, where a lot of our local schools are sourcing from our local farmers to, bring local produce into their meal programs. So that is pretty much what the Gold Country Food Hub was started around. After I farmed for about 8 years, I changed my whole career path midlife and started farming at 50. And I farmed for 8 years and realized that was a lot of hard work. But what I really liked was that I was able to distribute some of my produce through the Tahoe Food Hub. And that was really, what inspired me to be like, hey, we really need to have a food hub down the hill. So I now work with over 100 local farmers and artisan food producers. And basically, I represent them in being able to, and provide distribution channels for them to be able to sell their goods through these distribution wholesale market channels. So instead of these entities, getting produce from, industrial agricultural operations and products that are sold through like Cisco and things like that, they also have the opportunity to buy local. So a few of the programs that we operate currently include our Healthy Groceries program. And this started just a few years ago through a grant from Sutter Auburn Faith Hospital. And it basically allowed us to partner with Chappaday Indian Health and the Auburn Renewal Center to bring bags of locally sourced farm fresh produce dairy, grains, and other farm products to patients in their diabetes prevention programs and other health and wellness programs. And this year, we are hoping to continue this program and start being able to bring these groceries to patients in their mental and behavioral health programs. Sutter has funded this program for 2 years, and they had invited us to apply for to double our funding this year. But with some of the given changes that are happening, we're still waiting to hear whether they're going to be able to support us in any way. So we're, right now working on, just looking at other funding opportunities to continue to fund our Healthy Groceries program. The other couple of programs that we've been running, the Food Producer Resource Hub, we actually received a grant from the Southwest Regional Food Business Center to develop an online resource hub for farmers and artisan food producers. So we've been working on that over the last year, and I do a lot of mentoring with local and beginning farmers. So I thought that this would be a really good resource rather than me communicating all the connections that I can make for them, that I could actually put it into, an online portal where they could go in and have access to all the resources. And it's pretty cool. It uses AI technology to basically go out on the web and find all the resources that we've identified and keep everything really current. So it's considered dynamic content. So it's always current and up to date. That'll be launching later this month. And this project was originally scoped for a $75,000 budget, and our grant was cut to $25,000. So it's a pilot project. So we're also fundraising to be able to, expand the scope of the project. The other thing we do is outreach and education. And some of you may have come to a few of our events over the last couple of years. We did a screening of the Kiss the Ground movie that was all about regenerative agriculture 2 years ago. And then this last year, we did the sequel to that, which was the Common Ground movie. And we had, I think, over 120 community members show up for that second screening. So for any of you that know me, I am extremely passionate about growing clean, healthy food and getting that out to our community. I'm different from most food hubs. I don't handle or distribute any conventionally grown food that may contain GMOs, chemical and synthetic fertilizers or pesticides. So, I'm the cheerleader in the community for our farmers to really be growing using, organic practices, whether or not they're certified organic. So, and this year, I also, this is my part-time job, and I also run the farmers marketplace in downtown Auburn, which is how this all started 6 years ago. And so this year, we're actually, the farmers marketplace has the wholesale program where we do farm to school. We are the aggregating vendor for Feeding the Foothills. Which means that we buy product from local farms and bring it down to the food bank. And this year, over the next year, we're going to be transitioning all of this wholesale into the Gold Country Food Hub so that it's fully operating in, different types of programs and food distribution. Oops, I went twice. Hold on, there we go. Nope, we're there. So one of the things that I really wanted to talk about, just with what's going on right now with federal funding freezes and things, is the Farms Together program. And this is the one that really has provided funding to help California farms, specifically socially disadvantaged farms, really be able to build capacity and resiliency in their farming operations. So the farmers marketplace was assigned as the aggregating vendor for Feeding the Foothills. And through this program, It is actually a national program, but in California, these are the statistics, and these are the only statistics that I'm going to show you tonight. But you can see from this program, since it started, I believe about a year and a half ago, it's really had quite a big impact in our local, California farming community. They've worked with 598 farms that have been supported through this. And what that means is, the farms have been able to, increase their product sales, do crop planning, grow a lot more food. And this has allowed them to have better revenue, have security in their farming operation, not be sitting on products that they've grown and not sold, that they end up donating or just tilling back in. And it has also given them the revenue they need to, be able to put in infrastructure, whether it's new irrigation systems, getting a tractor, walk-in fridges, refrigerated vehicles for transportation. So it's just really improved their business success and long-term sustainability. So it has also supported 39 food hubs in California, including the farmers marketplace. And through this, it has really helped the food hubs be able to establish, solid relationships with our local food banks. So for each county, one food hub or aggregator is assigned to the food bank to be the one that, uses the budget allocated to buy from the local farms and bring that food every week to the food bank. So it's been pretty amazing. It was cool. We started our contract in November. And the food bank had, I believe their budget was about $9,600 a week to spend on locally produced produce, products from the farms. So it was really amazing. We were bringing in pallets and pallets of food from our local farmers. And then 41 food banks altogether. So Feeding the Foothills is just one in California that's been able to be a part of this program. So this is my favorite statistic, 10 million plus pounds of fruits and vegetables distributed through food hubs. To me, that's amazing. And a lot of our California food hubs are sourcing from organic farmers. So, we're really getting clean, healthy, nutrient-dense food into the food insecure communities. So it's pretty amazing. So we've all heard about federal funding freezes. And this actually ended up affecting a lot of our programs for California farmers. Everything from equipment, climate change, grants, and everything. So even programs that, like the grants had already been contracted, farmers are out there buying their walk-in freezers, and then all of a sudden they're finding out, oh, we're frozen, the funds are frozen. We don't know if you're going to get that reimbursement that you're contracted to be getting. And so that did impact our business as well. We were actually held up. Our contract got put on pause for 5 weeks. So if you think about, for a small business and your income is about $11,000 a week, and all of a sudden it's paused, that was a lot for 5 months. Fortunately, through amazing advocacy from our farmers, our food hubs, the California Association of Family Farms, Fresh Approach, the Farms Together, everybody, they jumped on and literally within a few days had a whole advocacy, program for everybody to follow. Some of the members in here actually, took the links and did it and got in and contacted Congress and got their, voice heard. So in a week, it got reinstated. The unfortunate thing is that the 2024 program got reinstated, but they were already contracted with some food banks and food hubs for the 2025 2-year tranche of funding. So this would start up next July and go for another 2 years, but they have decided to cancel that program. So that's a pretty big impact. It's leaving a lot of our farmers feeling very, just really uncertain about what's going to happen. They've got teams of, people out there working on the farms. They've put in infrastructure all to be able to supply at this bigger capacity. And then all of a sudden now, like, it's very uncertain whether there's going to be funding beyond next June. And, as a food hub for me, it did impact Feeding the Foothills. They only had so much money left in their contract. So they actually had to cut their weekly spend by about 60%. So we're able to continue through next June. The hope is that this program, it's the LFPA program, Local Food Purchasing Assistance Program. And, we're hoping to hear that is going to come back next year. Maybe it will just have some changes in, the designation of how the funds can be used. So what can we all do, right? Well, contact Congress today about the Frozen Farm Program. And I think really, the best, link that I can provide for you is through CAF.org, and that's the California Association of Family Farmers. And they have a link in there. They have a template. They have a script to use to call your elected officials, and also an online form you can fill out to submit a letter. And so, we're hoping we can keep this going and get, more of these programs that have been, paused or canceled for our local farms, get them reinstated. And, we're hoping for a farm bill. So the other way you can take action, obviously, with all of our entities here, is to support our programs. So we have a table at the back for the Gold Country Food Hub with a little QR code you can scan to go to our website, and you can make a donation. We're looking for volunteers. We still have some spaces left on our board of directors that we would really like to fill to, really have a broad community perspective on the direction that we're going, and really coming up with creative ideas of how we can continue doing the work that we're doing. So thank you all.
Yeah, she's very long. Oh, is it kind? Oh,
okay. Am I on the right slide? Nope.
There's a piece of the slide for you.
There isn't a slide for me. So I'm Neva Parker. I'm here to do the Q&A section of the presentation. I just want to say, I'm going to applaud everybody again. That's a lot of information to pack into just a short presentation, so I am very, very impressed. I also want to put a plug out for folks who are considering volunteering. I've done several shifts with the Feeding the Foothills, and it's a wonderful experience, so I highly suggest it. So we've got about 10 minutes to do a Q&A, and so I'm going to ask just a handful of questions, and I guess whoever just pops up and answers. So the first question I have for you is, what does the Placer Food Coalition do? And can you give more specifics about how we can be involved? And is there the Placer Food Coalition? That was a question we got. Does that sound familiar?
I can speak to the Placer Food Coalition. I don't need the mic, I can yell. Okay. I've got kids, I know how to do that. The Placer Food Coalition is part of Human Services, part of our Public Health, and our Health Education Council. We've come together to try to bring as many people together that we can to talk about food insecurity and how we can resolve that in our county. We try to encourage people like the Salvation Army, some of our local community-based organizations, Tammi is part of our Free Coalition. So we meet quarterly, and if we meet, we just try to talk about what we can do to help the issue. One of the things we're talking about right now is how can we get some like refrigerators into some local communities so that there's refrigeration for food, leftover food, donated food, however. So we're trying to look at some of those avenues. We've also created the Eat Well app, and we're trying to connect restaurants with the community so that people can have those one-off meals. It's not the large quantity meals that stores would donate to the food places. It's more just like restaurants, those end of the night meals that somebody can pick up or whatever. There's not a refrigerator to store those, so they would post it on the app, and then a community vendor can pull those meals up. So those are the things that we're working on right now. We want more of the community to be involved. So if you're interested, please sign up. I got a little sign-up sheet, and we can send you more information. I also have the next meeting dates too. We bounce around and we do hybrid. So I don't have any locations on a flyer, but you can reach out and let me know when they are.
Great.
Hopefully that was good.
That's great. Thank you. So our next question is, how does the county administration support or not your organization or program?
I'm sorry, can I see the question again?
Yeah. How does the county administration support or not support your organization or program?
So it's pretty direct how funding is sent to the counties. So, things come from federal coffers. They come to the state. The state is our oversight. We are a county administered state. Not every state is. There's only about 11 in the union. North Carolina is one, South Dakota is one, but California is one. So all 58 counties run their own programs. That money is then, there's a California Welfare Directors Association that's a lobbying or arm that sort of supports county government, especially health and human services programs. And that works with the California Department of Social Services, the legislature, the governor's office, Department of Finance, all those folks to determine how much money is going to come to each of our counties to fund our programs. Typically, it's caseload based with projections of where caseload might grow. We, as a county administered state, that money comes to us. We hire all of the folks that we need, eligibility workers, myself, all of my supervisors, our admin staff, to run this program and support the people that need help. I hope that's answering the question.
Sounds good. Yeah, go for it.
Just a comment from us at the Food Closet. The county itself has done several other things that have made it. The county itself has, through other programs, has had direct impact. When I first came to the Food Closet, probably 10 to 15% of the people who came to us were homeless. Now it's down at the 5% level. And that's because the county now has the shelter systems in place, and many of the people are getting food that way. And so they don't need to come to us. They've also been good advocates for us. And as I mentioned before, there's the one grant that they provided earlier this year to Stand Up Placer that has cash flow to us. It's helping us as well. I see this as a very strong county advocacy group for social service needs across the board.
So the next question we have, we just saw in one of the presentations how SNAP is being reduced for some of the immigrant population. So how are immigrant communities being served given that situation?
The immigrant population is coming to us, and then I think most of the other equivalents like us are Food Closets. One of the organizations we collaborated with closely over the last 3 years is the Latino Leadership Council in Chapaday. Both of them have quite a bit of impact and direct impact in there, and that was important because I think there was in the past there was a concern about people coming and receiving food from us for fear that they might be exposed for government benefits, and working with Chap a Day and figuring out how to position things, working with Latino Leadership Council help. We are, we're still going to, anybody walks across the threshold, they're going to get food. Doesn't matter.
Let me just add, we have over 70 groups. We have Russian, Ukrainian groups. We have Latino groups that come the back door to pick up food. They've got the language handled, and they take care of all those folks. And if somebody comes knocking at the door, we refer them. And people do come knocking at the door, and we're not the place where you get food. We do refer these to these other fabulous groups.
So that's it for the questions we received. I do have a question real quick. My question is, it's been suggested that we contact our congressmen and our federal representatives. My question is, what help have we received from the state level? I mean, I realize budget, but for our elected representatives, how responsive are they to your particular needs? I'm sorry, that's a big question.
Well, I guess the results we'll see. But we have invited every single one of them to the food bank to help them better understand the program. Some have come, some have not. Some say they're interested. We will see what happens. But I say just keep reaching out, making noise. If anybody's interested in any of those phone numbers and emails that I had on my PowerPoint, let me know. I'll zip them off to you. All we can do is keep trying. But so far, well, we'll see. Not the answer you were looking for.
Yeah, I think that's a question. Yeah, she can. So, I mean, maybe more suggestion. So I'm kind of new to understanding sort of how all this fits together, but for average Jane and Joe, this is all great, but is there overlap? Or it'd be really great if there's an article in the journal or SACB or something that maybe a flow chart of how, because these are all interconnected. You're doing something that works to this thing and that goes to that, and a really cool diagram of how all these things interconnect. Mm-hmm. To me, I'm visual, but it's blah, blah, blah. Anyway, there might be an idea to help people understand that you take out one little cog and, that it's all so critical. Like you said, you can't go to Feeding the Foothills, you're not going to get them food, right? But the word Feeding the Foothills, sounds like you could. Anyway, you get what I mean.
The visual I've used for people is wholesale retail. Yeah, and so Feeding the Foothills is wholesale. They are distributing out through other people. We're the local, on the street, customer-facing organization, like the 70 other groups you work with.
On our sheet on the back, we have a nice little visual, but I think a countywide food matrix visual, I think, would be a great, in fact, I just wrote that down when you stood up. I think that would be a great idea.
Yeah, for sure.
All right, I think I need to cut it short. I don't want to. I'm so sorry, but we have to be out at a certain time. So if you have more questions, I'm sure you guys will be willing to answer. So Dorian, I'll turn it over to you.
So one of the things that we really wanted to do this evening is we wanted to some level challenge you. And the way we're going to do that, Lucy's going to come up and we have a request to make of you, and she's going to do that, and then I'll come back and we'll do the wrap up. Okay. And thank you so much to our speakers. I have to say, I learned so much myself just in putting this together and having conversations with your four of you. So, yeah, there's a lot to learn. Okay.
Well, I think Dorian just said it, that we would like to challenge you tonight to think of one thing that you could commit to helping alleviate hunger. I don't think you could help but think of one thing, because as we have sat here, so many ideas have come to my head as your idea of a diagram. I know all of us will leave here tonight with a different awareness. That's happened. What might you do with that awareness? What maybe are you inspired to do? What might you do as an individual? Would you like to volunteer your time or your money? Maybe you could visit these websites to learn more. Continue the conversation. I know for my part, now I feel empowered to refer people to SNAP and CalFresh, which I didn't do before. I'm going to commit to being able to do that. And then we're going to ask you to think about things as well that maybe AADC as an organization could do. Possibly come to every meeting with a non-perishable food item, and that gets donated to the food closet or to the Sierra College food closet. Think about what the Democratic Party could do, and can you be a part of being an activist or advocacy in that area? And finally, what you as a community member might do. Maybe your neighborhood, organize a food drive.
So I just want to, before you leave, I have a link here to a survey. We would love to know what you think about tonight's event. If you wanted to fill it out there, or you can use the QR code. And I also just really wanted to thank people before we're breaking up here. I wanted to thank our speakers for taking the time. You can tell that they put a lot of effort into their presentations and to be able to provide us with a lot of information. So I really want to thank all of them. I really want to thank everybody on the Community Events Committee of AADC who helped to put this all together and provided a lot of thinking about how to best do this. The AADC board, which is very supportive of what we're doing and have given us a lot of help. And then also the membership committee who are here tonight checking people in and getting you all to come out tonight. So thank you very much for coming, and we hope to see you again. And again, if you could do the survey, it's like 5 questions really fast. I promise. Okay. Thank you all.
Thank you, Laurie.